We are some of the education and mental health practitioners within the mental health support team.
We're here to tell you about our team and some of the services we provide across the Wirral.
Mental health support teams are a new service designed to meet the mental health and wellbeing needs of children and young people in education settings. Our service will sit alongside existing mental health support that schools have access to, such as the primary mental health team. This is done over 3 core areas.
Delivering brief evidence-based interventions to support children and young people with mild to moderate mental health difficulties.
To support schools in developing their whole school approach in mental health.
To provide timely advice to school staff and liaise with external services, which will help children and young people to get the right help and stay in education.
The team is made up of education mental health practitioners and children and young people mental health practitioners. There are also other members of the team that help it function correctly, such as admin services, a team manager and clinical supervisors.
Our team is an early intervention service that works with children with mild to moderate mental health difficulties. A mild to moderate mental health issue is when a person has a low number of symptoms that have a small or medium impact on their daily life. This would deem them suitable for our service. Our team will act as a link with the Specialist CAMHS clinical team, who support young people aged 0 to 18 with a moderate to severe mental health difficulty, which is having a significant impact on their daily functioning.
A mental health support team will work within schools in the Wirral. Each school under our service will be assigned an EMHP and a MHP.
The role of the EMHP is to offer assessments and treatments for a range of mental health needs that may be less complex or may be managed by time-limited interventions. For example, children and young people who demonstrate anxiety, low mood and behavioural difficulties which do not meet the criteria for Specialist CAMHS clinical support.
Interventions will promote resilience and support children and young people to develop their skills and techniques to manage their emotions. These will be delivered through a range of individual work and group work for both children and young people and their families, as well as through whole classroom or assembly activities, depending on the assessed needs.
Another significant role that the EMHPs provide is supporting schools to develop their whole school approach. This ensures that every member of the school team feels empowered to support the well-being of children in their care. This can be done through delivering staff training, one-to-one support for staff in meeting a child's additional needs, performing whole school mental health audits, and also supporting senior leadership teams in the development of new school policies.
The role of an MHP is to ensure the children and young people are going to the right service and provide support to schools in creating referrals and signposting. They may also work with families who need some extra support but don't currently meet the criteria for certain interventions. This could be due to high risk or other complexities. Mental health practitioners will also support the EMHPs in running education groups and training sessions in schools.
The team is currently able to cover 53 schools within the Wirral and looking to expand this in the near future. The NHS long-term plan has announced by 2023/24, mental health support teams will be rolled out to at least a quarter of the country. Wirral CAMHS will continue to bid for further funding with the aim of eventually being able to increase their offer across all schools in the borough.
For more information and resources on mental health and wellbeing, go to www.mymind.org.uk.